Good morning, everyone. Today we'll talk about blood pressure, why it matters in older adults, how to measure it correctly at home, what non-drug changes make the biggest difference, how and when to use medicines safely, and how to turn all of this into a daily routine you can actually live with. This is general information. Your own targets and treatment should be personalized with your clinician. High blood pressure raises the long-term risk of heart attack, stroke, kidney disease, and even cognitive decline, often without symptoms. Targets aren't one-size-fits-all. In many older adults, we individualize goals based on overall health, frailty, fall risk, and what you can tolerate. The point is not perfection, but steady, safe control. Control begins with correct measurement. At home, avoid caffeine, smoking, and exercise for 30 minutes before checking. Empty your bladder. Sit with your back supported and feet on the floor. Place a properly sized cuff on a bare upper arm at heart level. Rest quietly for 5 minutes, then take 2 readings 1 minute apart and record the average. For the first week, measure morning and evening and keep a log. At an office visit, measure both arms once to check for a difference. In older adults, stand and recheck at 1 and 3 minutes to look for orthostatic drops, because dizziness and falls matter as much as the number itself. Good technique prevents over or under treatment. What can I do without pills? Quite a lot. Salt is the biggest lever. Aim for less than about 1 teaspoon of salt per day from all sources by reading labels and shrinking portions of high-salt foods like cured meats, pickles, packaged snacks, and salty cheeses. If your kidneys are healthy and your medications allow, raising potassium-rich foods, vegetables, fruits, legumes can help lower pressure. A dash or Mediterranean-style pattern, colorful plants, whole grains, beans, nuts, olive oil, fish once or twice a week, and less saturated fat consistently lowers blood pressure, especially when salt is reduced. Weight matters too. Even a few kilograms off can bring meaningful drops. Pair that with movement. Aim for about 150 minutes per week of moderate aerobic activity, plus twice weekly muscle strengthening and regular balance practice. Think 10-minute walks after meals, chair rises, wall push-ups, step-ups on a low stair, and simple balance drills at the kitchen counter. This combination lowers pressure, improves energy, and cuts fall risk. A practical kitchen tip: in carefully selected people, no advanced kidney disease or high potassium, swapping part of table salt for a potassium-enriched salt can further reduce blood pressure. This is not for everyone and needs a clinician's approval, especially if you take ACE inhibitors, ARBs, or potassium-sparing diuretics. Now, medicines. Many people, especially if they are more than 2010 LMHI above goal, do best starting with 2 medications in a single pill. Common pairs include an ACE inhibitor, or ARB, plus a calcium channel blocker, or a thiazide-like diuretic. Single pill combinations improve adherence and smooth out control. Beta blockers are excellent when there's a specific reason, coronary disease, certain arrhythmias, or heart failure, but aren't first choice for blood pressure alone in most older adults. Start low and go slow. Monitor kidney function and electrolytes, and watch for ankle swelling with calcium channel blockers, frequent urination with diuretics, or cough with some ACE inhibitors. Morning or evening. For most people, outcomes are similar. The best time is the one you can stick to every day. If you get lightheaded in the morning or have big drops at night, personalize the schedule with your clinician. What else do we track? Your home averages, office readings, kidney labs and electrolytes, and symptoms. We review all medications because some, like NSAID pain relievers or decongestants, can raise blood pressure or blunt control. In older adults, we routinely check standing pressures to balance treatment with safety. Is lower always better? Sometimes lower targets bring extra benefit, but they also add risks like dizziness, fainting, or abnormal labs, especially if the numbers were obtained in very controlled settings. We weigh potential stroke and heart benefits against side effects and your priorities. The right answer is the one that keeps you safer and steadier. Let's turn this into a daily plan. First, measure, record, share. Check at consistent times with good technique, write down averages and bring them to visits. Second, cut salt, add color, read labels, shrink salty portions, and fill the plate with vegetables, fruits, legumes, whole grains, nuts, and olive oil. Aim for adequate protein to keep muscle. Third, schedule movement like a medication. Short, frequent walks, 2 days of strength, a few minutes of balance most days. Fourth, keep medicine simple. If appropriate, use a single pill combo. Take it at the same time daily and adjust based on labs and symptoms. Fifth, flag dizziness or near falls quickly. We can adjust doses or timing. Sixth, special cases need special tweaks. Diabetes, kidney disease, heart failure, arrhythmias, sleep apnea, or frequent NSAID use all influence targets and drug choices. In the end, blood pressure care is a marathon, not a sprint. There's no magic, just small, steady steps done well. Accurate measurement, less salt and better food quality, regular movement, and simple, consistent medicines. Those steps lead to calmer arteries, a stronger heart, a clearer brain, and more independent years. Thank you.